Good afternoon, everybody. Karima Burka from IHE-Europe speaking, and I would like to introduce this first Europe vision from IHE Experience Workshop with the two topics, an update from UNICOM, and the second topic is about the vision of the future of healthcare by the COSIER. So first I would like to introduce Robert Stegwee. Robert Stegwee is a consultant for health informatics based in the Netherlands. His passion is in health, improving the healthcare experience from a healthcare consumer and professional perspective. He has been involved in healthcare IT in different capacities since 1993, starting in hospital environment and consulting in different sectors of healthcare. Robert is currently serves as a member of the board of HL7, the Netherlands. He is also chair of SEN Technical Committee 251 on health informatics, and as a member of Joint Initiative Council on Global Health Informatics Standardization. Currently, he leads UNICOM Work Package 1 on IDMP related standards and terminologies, in which most relevant standards developing organizations participate. So I let now the floor to Robert to present IDMP in Europe. What does it mean for you? Please, Robert.
Thank you, Karima, and thank you all for joining. It's my pleasure to be here at the IHE Experience Sessions. I'll tell you a little bit about UNICOM, and I'll start with the aim and objectives. So UNICOM is a big project, and its main aim is to break down the barriers that are hindering the free flow of medicinal product information, and it needs to be detailed, semantically coded, interoperable. And we're not just limiting ourselves to the EU, we are actually working on this across the globe through the IDMP set of standards that have been developed quite some time ago within the realm of ISO. So our objectives within UNICOM are to implement IDMP for the marketing authorization of medicinal products in the EU and at the EU level. That also means that the member states' cross-border digital health services need to include IDMP, both for e-prescribing and e-dispensing and for the patient summary. I'll get into that a little later. And of course, we want to look at the possibilities of implementing IDMP in clinical practice. Three topics are given here. I'd like to just give you an example of the digital health service that we envision enabled by IDMP. So there's the story of Elena. Elena is a businesswoman who travels often across Europe, and she's on a flight from Athens to Brussels. And when in Brussels, she experienced intestinal pain, which for her is quite heavy because she also has some other health problems. But she doesn't have her regular medication with her. So she looks at the local drugstore and looks for over-the-counter medication to overcome her intestinal pain. And given her medical condition, she really needs to figure out which one is best for her. And for that, she just scans the barcode on one of the bottles, and she can actually overcome the language barrier. So it's not just Flemish or French that she needs to read, but she can easily see what this product is called in Greek or in English if you want to. And she also can get some decision support, which one goes best with her health condition, with her illnesses that she's taking medication for as well. And actually she can update her health record as it is available on her phone, so she can also inform her doctor at home of what she has been taking on her trip to Brussels. This story is detailed on YouTube. Once you get your hands on the PowerPoints, then you can click the YouTube or go to the YouTube channel of UNICOM. So it's really about how does this happen? This is not possible right now, but this is the future story of digital health services, what we can expect once IDMP has been implemented across Europe. So how do we do that? What does UNICOM do in that space? Well, UNICOM at a glance, it's a big project. It's an innovation action supported by the European Commission. A lot of partners from different parts of the medicinal product life cycle, so the competent authorities, also the e-health competence centers, but industry partners, and as Karima mentioned, also the standards developing organizations and related organizations. We are in our second year right now, and we will be running for the full 4 years and maybe even a bit longer because of the COVID, because we started late in 2019, and after 3 months, we were, of course, in the same situation as everyone on this call. I won't go through all the 13 work packages. It's a lot of work, a lot of things are going on, but it's good to know that there's national implementations planned in a number of countries that are listed here, and that really makes it real. I mean, it's not a research project, it's really an innovation action aimed at implementing things. And we're basically looking at 3 different kinds of high-level processes that we're supporting. It's the marketing authorization and the surveillance part. That's really at the health system level, at the country level, or at the EU level, if you will, or at the global level, where you really look at how does this work, which medications are authorized, how do we do the surveillance, how do we make sure that it stays safe. And then, of course, that safety needs to be translated to the clinical use of the medicinal product. So that's the whole patient and professional-oriented part of the story and of the process. And then, of course, there's the physical part where you need to move boxes from one place to the other and make sure that nothing happens in the meantime. So that's the controlled supply chain. Those are the 3 high-level processes that we're looking at, and I'll refer back to them a little bit later as well. So this is what we're doing. And of course, the title of this presentation is what it can do for you. But before we go there, I'll zoom in a little bit on my work package, the standards related, or the IDMP related standards and terminologies. We're in this with, as I mentioned, 11 organizations, actually 12 if you count NICTIS, because NICTIS is guiding the CEN and ISO involvement in this work packages and is leading this, as the technical committees cannot be a participant on their own, but the other standards organizations are directly involved, including the UPSLA Monitoring Center, which is the WHO, World Health Organization, collaborating center for the pharmacovigilance, and everything that goes wrong with medication is monitored there and is put in a big database that can be used. And there's also the Norwegian partner that takes care of the ATC codes. For those of you who are aware of medication, ATC is kind of the active therapeutic chemical description. So what is it that actually makes this medication work? So there's a lot of groups involved here. And what we need to do as Work Package 1 is to facilitate the implementation across all the standards that are in place, and figuring out where the needs are, where the gaps are, and also provide inputs about the use of standards to all the other work packages within UNICOM. So what does it mean for you? What is it, and what it means for you depends much on your role in the life cycle of a medicinal product. I already gave you the 3 high-level processes, but there's all kinds of different organizations involved. If you're in the pharma industry, so you develop and produce a medication, your role will be quite different from the professional that actually prescribes or dispenses the medication. Then in between, there's the regulatory and authorization organizations. like the national competent authorities and the European Medicines Agency. And a very important role is in the dissemination and information part. There's several organizations, and it's different in every European country how it's organized, but they provide the databases that combine the regulatory information with the clinical information, with the leaflets for the individual patient, et cetera, et cetera. So they kind of bundle the information for use across into the clinical field. We'll see a bit more about that. And of course, an important thing is what actually happens if I take the medication. So when I utilize the medicinal product, and what's the outcome? You can look at that on a global scale, but you also can look at that from a personal perspective and say, well, did something bad happen to me when I took this drug? So that's kind of the life cycle. And depending on where you are with your organization or your client, things will be different. And I'll give some examples of that. Also important to know is which processes are you engaged in? Is it the health system process, so the surveillance? Is it the actual use, clinical use of medication? Or is it supply chain? Or are you playing in all three levels of processes? That also will give a different message on what you're involved in. So if we just look at the submission of medicinal product information, that's one of the aims of UNICOM, to have a globe or a unified European submission of medicinal product information. It's from the pharma industry and the development and production part to the regulatory and authorization part. And what we're working on right now is to have an HL7 fire specification to actually send your information to the regulator. That is highlighted by the EMA, European Medicines Agency, IDMP implementation guide for Europe. And actually it's focused on this market authorization and therapeutic surveillance part of the process. So that's kind of where we start our journey within UNICOM. I won't go through the full journey, but I'll give you some examples that were highlighted from a clinical perspective by one of the community of expertise presentations that SNOMED International took care of just last month. And I borrowed these 5 examples from their presentation. Again, you can go to YouTube to find the full community of expertise presentation, including a real-life example from the British authority, the MHRA. So if we're looking at these medicinal product dictionaries, as I mentioned before, what does it mean? They are kind of in the middle, and they take information from the regulatory and authorization part. They add to that a lot of information from the literature, from the experience they have, from the consensus within the country about what to describe, what to prescribe, or what the doses should be, and then deliver that information for electronic prescription systems and for the pharmacy systems in the country. So how do they do that, and how do standards play a role in that? Basically, they take from the National Drug Database, that's part of the information that's made available by the National Competent Authority, so your National Medicines Agency. They use that information to populate their medicinal product dictionary. There's identifiers, IDMP identifiers in the national system that will clearly identify what is the medication that we're talking about. And there's also EDQM standards for route of administration and dose forms, MEDRA codes for what is the intended purpose of this medication, what are known adverse events, et cetera, et cetera. For the medicinal product dictionary itself, there is an ISO standard or a technical specification that specifies the requirements for an MPD system. And then we move to the clinical field, where the medicinal product dictionary is the basis for a formulary and the decision rules to be used in clinical practice. And in clinical practice, we don't use just the IDMP identifiers, we have local medication identifiers. So those can be SNOMED identifiers, but usually they are not SNOMED, but they're a local medication identifier for that country specifically. But you can use the SNOMED drug model and the extensions to arrive at these identifiers. And also, in order to state the decision rules, you need to know what allergies are linked to which medications or other rules that are part of this game. And there's the requirements for a CDS, the Clinical Decision Support Knowledge Base from an ISO level there as well. So IDMP helps the medicinal product dictionary providers to get that knowledge, get the global knowledge and the global insights using the IDMP identifiers and link it to the individual products as marketed on in the hospitals and pharmacies of their country. So that's really what they do. So all the information that they get, it's easy to link using the global IDMP identifiers to link the knowledge that's available about the use of that medication into the formulary and decision rules as they publish that for the clinical use. So let's move to that part. So if we have the prescription and dispensation of medication, then we start with the formulary and decision rules on the left, as provided by the medicinal product dictionaries, and import them into our electronic health record system. So the key tool of any healthcare professional that includes or works in close collaboration with an electronic prescription system. In that electronic prescription system, it will be the local medication identifiers, but there could be SNOMED CT codes for the problems, allergies, and everything that's in the electronic health record system. And using that system, the right prescription or medication order can be produced by the clinician for an individual patient. And if we look at that prescription or medication order, well, I look at the prescription from an ambulatory setting. I won't go into the hospital setting just right now. We can also look at, well, once it's being used, how does IDMP play a role in that? We have the local medication identifiers, we have the SNOMED CT rules, and the prescription has a FHIR or a CDA implementation in HL7. It has the local medication identifiers, and it has SNOMED CT codes. Actually, you don't see IDMP directly here. Once you go to the cross-border prescription, then you should see also the IDMP identifiers that are linked to these local medication identifiers so that they can be matched to the medication in the other market. Oops. Same thing on the dispense part. Where we see once the pharmacy actually dispenses the medication, that again can be an HL7 FHIR or CDA document, but what is added there is the GS1 item number and batch number. So the pharmacy can just scan the barcode, just as Elena did with her over-the-counter medication in the example that I gave before. The pharmacy can just scan the barcode or the data matrix, I should say, that's provided by GS1 and is used by most medication providers, so the pharmacy, the pharma industry, and that actually captures the right item number and batch number for use. You might have even seen these data matrices when getting your COVID vaccination, if you already got that. There's an IHE profile for this, of course, as was mentioned also in the previous slide for the community prescribing. There's a community dispense IHE profile, and together that provides you with the proper standards for a dispense record. So if we move on and go to the final part, utilization, what do we know? What do we need to know about utilization? I won't go into every detail. I just focus on adverse event reporting, because adverse event reporting is really important across the world. You need to know, and you need to be able to link what has gone wrong with a specific medication or medicinal product, and how do we share that information across the world, and how does it then become knowledge available to the doctor again. So what happens if an adverse event is there? The adverse event itself will be recorded in your electronic health record system. Hopefully there will be a doctor to help you out with the adverse event that takes place. And then the doctor needs to provide an individual case safety report. The implementation guide for the for the ICSR is really about standards in the EDQM, MEDRA, and IDMP field. So we need to translate the local identifiers and the SNOMED codes in the electronic health record into the format required by the individual case safety report. But because we have the IDMP medication identifiers in there, it's easy to link individual adverse events to the different reports from across the world and take action on that. So if there's something wrong with one of the ingredients of the medication, there could be a recall. And based on the GS1 item number and batch number, that recall can be very focused on the individual that took that medication and that needs to stop taking that medication. That's kind of the 5 examples that I wanted to go through. It's, as I said, it's a very dense presentation within just 20 minutes here. You're invited to look at the more elaborate presentation on YouTube. What I want you to know is that IDMP is being implemented in Europe right now. So in the upcoming years, there will be changes and we're all working very hard on the standards and terminologies to make sure that it's implemented in one way across Europe and hopefully across the globe. So we don't get different terminologies into play in different countries, and we need to yet again see if we can provide a mapping. Or so we're even starting with, one of the key parts of UNICOM is to also link to a global substance registration system so that we all use the same identifiers for the same substances that are making up a medicinal product. It does provide opportunities for all of you to that are engaged in the medicinal product lifecycle to think of new ways of using this IDMP compliant information for extra services. Sometimes the impact is very limited. As I mentioned, your prescribing process won't change. The only thing that might change is that an IDMP compliant code is added, or you just map IDMP compliant codes to local codes, or the other way around. But especially for the medicinal database providers, it's quite extensive because the interface with the national drug database will change. It will become an HL7 FHIR-based interface that provides you much more information and better standardized information to take from the national drug database into your MPD and then turn it into the useful services that you provide to the clinical community. So if you want to get and stay involved with what we're doing, we're organizing monthly community of expertise. There's a link there, but you can also visit the UNICOM website and stay involved and engage with us to solve the problems and to identify the opportunities that are out there. Thank you.
Thank you, Robert. So I'll let the floor now to the audience if they have any question to Robert. Please. You can use the chat or directly. Robert, I have one question. You described the scope, and this scope is very broad, involving many stakeholders in one country, but also in Europe. I would like to know how to prevent gaps between all the implementation of the use case that you presented. As we see, for example, this morning in radiology, where we saw that DICOM is used everywhere, but sometimes there are some specificity. So in IDMP, how can we prevent this kind of gaps?
Yeah, that's a very good question. What we try to do from work package 1 is to really make sure that we stay close to the implementations within the countries. As I said, 11 national competent authorities are implementing at least part of the IDMP solutions and standards. And any problems that they run into, we take up and bring them to the global standards world and try to solve them as quickly as possible there. Also identifying interim solutions, and maybe the standardization process takes a little bit longer, but at least we have a full register of all the issues that the individual participants within UNICOM encounter, and add that and bring that to the attention of the people working on the standards, so that they are sure that they can make changes, or we bundle that experience and bring it to the other countries through the work packages within UNICOM. As I said, we do have a full register of all the issues that we've identified. That's what we started out with in 2020, to identify what are the known issues in implementing IDMP. And we're working hard with the SDOs to solve them and bring that information as quickly as possible also back to the work packages within UNICOM, so they can do that. But it is a challenge, and some people look at the EMA implementation guide for HL7 fire and say, well, that's the truth. Whereas the linkage between that implementation guide and the global HL7 fire standard still needs to be established and maintained, so that we don't get implementation guides that vary from country to country or from continent to continent. So it is very much hard work, and we're determined to stay with it.
Okay, thank you. Any question from the audience? No. So last question from me. A few minutes. So how do you involve industry in IDMP project?
As I mentioned, there's already some IT industry partners directly involved in the project. So there's, for instance, especially for the cross-border part, the community that's responsible for the development of the Open NCP, the National Contact Point software that's used for the cross-border implementations. They are part of the UNICOM consortium, and they will pilot the changes that are needed to the software in order to make sure that that this happens. Of course, we also have the outreach through IHE to the IHE Connectathons, and you might as well be identified as leading that work, Karima, to make sure that that we have the possibilities to actually test the new specifications with IDMP, with the vendor community that's linked to the IHE-Europe Connectathons. And that will, we're starting the preparations right now, and we already see the first things happening both in the patient summary part for both the medication list, but also for the vaccination or the immunization part of the international patient summary, where it's crucial that we get a global identification of vaccines. We've been working on that, especially for the COVID vaccines. And there's also a broader collaboration going on outside UNICOM between the European Medicines Agency, the FDA, the WHO Absolute Monitoring Center, to come up with a global vaccination identification. And there will be a community of expertise on that in the fall, I think maybe October, November. We'll have the outcomes of that initiative presented. But we're already working on a list, and have been working also with the HL7 Fire Connectathon on a list of these are the IDMP compliant identifiers for the COVID vaccines. So they are, at least in a pilot situation, they're available for use.
Thank you, Robert, for all this explanation and very rich presentation.